In this video, we're going to talk to you a little bit about working with a provider, which is really important to do when you're talking about something as chronic and as serious as PANS or PANDAS. Homeopathy is something that you can do yourself over the counter. You can look up things or take a quick course or buy a book for something like acute colds or upset stomachs, things like that. But when you're talking about complex chronic illness, it really is important to work with somebody who understands PANS and PANDAS and understands homeopathy very intimately. And the reason for this is, as we talked about in the last video, PANS and PANDAS kids are just really sensitive. You know, I actually conceptualize them as hypersensitive, not as sick kiddos, because the reality is they're just reactive to things that are bad for all of us. And if we paid attention to what the kiddos with PANS are reacting to, we would all be healthier if we just eliminated those things from our environment. That being said, they do have the greater than average possibility of aggravating. The aggravations do not have to be a deal breaker or a scary thing, but they do need to work with somebody who knows how to manage them, to reduce the intensity of them, and to understand what needs to be the next best step to help pull them out of it, and to move forward and manage them appropriately. So it's important to understand, work with a provider who understands PANS and PANDAS so they know how to manage the case, because the way we manage a case depends on the condition itself. So the way I would manage a case that is a PANS or PANDAS case is very different than I would manage an autism case, which is different than I would manage a case that is a combination of the two. Same thing if I'm treating something that's very acute, I'm going to manage that very differently than I'm treating something that's very chronic. And so it's really important to understand PANS and PANDAS and all of the things that contribute to it so that we identify anything that we could be contributing to it and then know how to manage it. And then obviously knowing homeopathy really well is important too. This isn't something that, again, over 3,000 remedies that you can choose from. You can't really just put in your symptoms and look it up and get a good fit, because there are a lot of remedies that cover similar symptoms, and it's understanding how they have been used historically, what they've been tested and proven on in humans, and what they've been clinically verified to be effective for. And then understanding also what is common versus characteristic in a PANS or PANDAS case. So what is a useful symptom? And so that's where it's really important to work with somebody who really truly understands what it is that they're doing. I know you wanted to talk about this a little bit, Jody.
For me, I feel like it was more important to me to work with someone who, like, I wasn't going to have to explain what PANS and PANDAS was. So, you know, the fact, like having a provider that already gets it, I'm not having to explain anything. That was really good for me. But I think it's, again, just to echo what you said, so important because our kids are complex and confusing. And it it makes sense that it's easier for someone like you who've seen case after case after case of PANS and PANDAS that you're going to understand those specific nuances better. And so I think that it's just it's really important.
Yeah. One thing that we've really found that we do differently is that a lot of people are used to they've heard about PANS or PANDAS like Jody did from the community, and they've heard about it from other moms or somebody else who had an experience, and they're going to try and prove to doctors that this is what's happening. You don't have to prove it to us. We know, we trust you. We know that this is really happening, and we just need to understand your experience. And so having somebody who gets it and knows makes that a little bit easier to let go of that need and just be able to share an experience. When you do choose to work with a provider, it's important to find out, if you're not going to work with Resilience Naturopathic, to find out if they're practicing classical homeopathy or other types. As I said before, there's been a lot of attempts to simplify homeopathy or change the way that it's done, but they're not proven, not used for hundreds of years and stood the test of time, and also in clinical verifications and studies. Classical homeopathy is really what we see to lead to these long-lasting healing results for these kiddos. Other therapies can be helpful. I'm not going to say that they're not helpful in some cases, but they more often than not are palliative rather than actually healing therapies. That being said, it's just important to ask your provider what type of homeopathy they're practicing, and asking if they practice classical Hahnemannian homeopathy following the organon of medicine where it's outlined. We talked briefly before about diagnosis and testing and whether that really matters. It's important to help us understand how to manage the case, but it's not going to make a difference for how we're going to recommend remedies. So it's more important if you need services that the testing could actually get you services for. But keep in mind, PANS and PANDAS is not a well accepted, broadly accepted diagnosis, and it may or may not actually be able to get you additional services. And there's no definitive diagnosis as well. And then lastly, I wanted to say that a lot of people ask us if they're working with a provider, how important it is for their kiddo to be involved. And this is going to vary from kid to kid. It's more important when we're dealing with preteens, teens, and adults, because the reality is there's a lot going on with an older kid or an adult that we don't know. That being said, we know that there are some adults who are nonverbal, and so can still work with those people. We just are going to rely a lot more on your observations for what's going on, and we're going to have to not make guesses about what we understand. We have to rely exclusively on a verifiable observation. For younger kids, if they're really precocious kids, it's great. We love having them involved so they can share their perception of what's going on and their experience of what's going on. It's not 100% necessary for younger kids. And for the kiddos who are a little bit older, those preteens and teens, if they are in the place where they're not as ready to participate or as willing to participate, occasionally we can, well, not occasionally, we still have a pretty good success rate when people are not participating. It just might be a little bit slower because we're working with partial information a lot of times in those cases, whereas the younger kids are more willing to share what's going on. So participation is beneficial, not 100% necessary. There are workarounds. It's more important with teens and tweens than it is with others. And in some cases, it's vital that we actually have the teenager. In some cases, we're not going to get any movement because we just don't have even remotely enough information to be effective. And so those are the sort of things that we actually talk to people about, and we tease out where we think they're going to lie. And so we'll let you know if you do want to consider working with us. We'll let you know if how involved we think that your child needs to be able to be successful. Jody, I know you wanted to touch a little bit other types of homeopathy before we wrap up here.
Yeah, I get super heartbroken anytime I hear somebody say that homeopathy didn't work for their kid. So even if you're here, you've tried homeopathy before, and it really, I would highly encourage you to do some research on classical homeopathy. More than importantly, ask some moms that are treating with classical homeopathy. What we know is classical homeopathy is doing amazing things in the PANS PANDAS community for so many kids. And so I don't if, again, kind of shadowing what you said, if you were doing another form of homeopathy that could have been more suppressive or palliative, and your kiddo's body just didn't have the opportunity to go through that healing process that it needed to go through. So Devin, I don't ever want anybody to give up on homeopathy, because I think it's amazing.
So we hope that these videos have given you a basic understanding of homeopathy, PANS and PANDAS, and why the two sort of go so well together, and why we see some really significant results with these kiddos. If you're not part of our foot group, I highly encourage you to join. We have tons of videos. Jody and I do a weekly mom and doc talk there, where we cover all sorts of topics related to PANS and PANDAS, and we take questions both beforehand and live. We also have doc and doc videos where we cover topics related to homeopathy for PANS and PANDAS. So I do encourage you to join that group and check out those videos if you haven't already. And there's a fantastic community. There's currently, as of this recording, there's 12,000 people in the group who are there to support each other, share their victories, celebrate, love on each other, and just help each other get through this. And it's a really positive, loving, supportive community. So I highly encourage you to join if you have any interest in participating in Facebook. The name of the group is Homeopathy for PANS and PANDAS. If you're interested in learning more about homeopathy, there are a couple of really great books that you can read while you're waiting for the book Jody and I are in the process of completing to come out, all about PANS and PANDAS and homeopathy. The books that we currently recommend related to homeopathy are Beyond Flat Earth Medicine. There is a free PDF that you can look up online. It's also available in our Facebook group if you're a member there. And then Impossible Cure by Amy Lansky is also a really good basic understanding of homeopathy that you can check out again until our book is ready, when we'll have that posted as soon as it is ready. If you guys have any questions or you are interested in potentially working with us, if you have not already given us a call, feel free. You can reach out on our website, resiliencenaturopathic.com, on the contact page, or you can give us a call at 858-461-8121, and you might even get to talk to Jody because Jody's part of our team. All right, I hope this helps answer a lot of your questions about homeopathy for pans and pandas. We are always open to feedback. If there's anything we didn't answer, we can jump on and shoot another video for you. So please give us comments in the comment section and we'll check them out and see if there's anything else that we need to answer for you guys to help give you some more clarity. Good luck on your healing journey. I can't wait to see you at the top of the mountain.